She wanted to know the vaccination situation in the conflict zones. And in the first phase, if you recall, that most of the focus was really on the health workers, the frontline health workers, the first responders, and so that particular phase did not go too deep into the insecure areas. But with this next phase that we've opened up to the general population, what we're doing is using exactly the same types of models that helped us eradicate white polio viruses, even in the insecure areas, which is by using strategies such as the reaching every settlement and reaching the inaccessible children. So working with the Nigerian military, we're going to be focusing on those areas where there is insecurity, and the military will be able to support the vaccination because, as you're aware, even within the military, there are health workers. So those health workers will be trained to actually take part in vaccinations in the insecure areas. And then for those places where we have internally displaced people, we will have our health workers actually prioritize those areas. So with places like the camps and temporary accommodations for people who are displaced, this is exactly where you can also use the Johnson & Johnson vaccine, so that once you vaccinate the people, even if they move, you don't have to go through the stress of trying to locate where they are. So we do have a plan, we do have a strategic plan to reach people in the conflict zones. Of course, we have to be mindful of the fact that these are conflict areas, and we will be relying heavily on humanitarian organizations that work in these areas to also help with giving the vaccines. The research component is actually going on. There's a multi-center study that is going on currently to see especially how Nigerians are reacting to the vaccine, right? There is a study that is looking at the effectiveness of the vaccines, but there are also studies that are looking at some of the side effects that may be linked to the vaccines. These studies are going on in the different zones of the country in collaboration with our eminent researchers from across the universities. We're hopeful that in the next few weeks, we'll begin to churn out the results of those researches so that we can get a better understanding of how Nigerians are engaging with the vaccines. So we're still going to be using the Med Safety application, which has been established by NAFDAC. We're collaborating. Yesterday, we had a meeting with the DG NAFDAC and her staff around how we can even improve the reporting of adverse events following immunization. In the first phase, there were some gaps in terms of how we're able to translate the hard copies of the numbers of adverse events and those people that were actually simultaneously reporting adverse events in the Med Safety app. So we had more reports from the traditional method. As you can imagine, people sort of find it hard to use electronic means, innovative types of applications to do reporting. So we're closing that gap, right? But in the second phase, we're also improving how people can report side effects using the Med Safety app. This is very, very critical, especially because as we roll out vaccines, as we talk about the possibility of producing vaccines locally, these are some of the criteria that the World Health Organization will be looking at before Nigeria is given the maturity level 3 that is, consistent with the ability of any country to be able to locally produce vaccines. We're still gathering information about what the local conditions are in Nigeria. So we're not looking at the third dose like some countries are beginning to sort of explore. Again, WHO and many world bodies in the public health space have made it very clear that countries should be focused on equity. So while there are countries that have not even received or reached any appreciable coverage in the vaccine coverage for even the first dose. Other countries are looking at a third dose, even though the 2 doses does provide some appreciable level of protection. So we should be looking at how there can be equity across the globe in the access to vaccines. We shouldn't have some countries that are over-vaccinated with COVID-19 and then countries that are under-vaccinated. Like we've all agreed, nobody is safe from COVID-19 until everybody is safe from COVID-19.